Hi, this is Professor Laws, and welcome to a video series on caring for patients with infectious respiratory diseases. Now, in this part of the series, I'm going to introduce you to the corona family and COVID-19. So let's get started. Have you ever wondered why the coronavirus was called the coronavirus? Well, take a look at what it looks like underneath an electron microscope. So that's why those spiky proteins you see outside that larger circle, that's why it gets its name. It kind of looks like kingly or like a crown. Now let's give you a drawing of this. Now you see that's the same thing, just an artist's representation of a coronavirus underneath an electron microscope. Let me give you a little trivia about this virus. The one we're talking about that causes COVID-19 is officially the SARS-CoV-2 virus, right? It's pretty big. It's about 1,250 nanometers in diameter. Now that may not register for you as large or small, but really it's the largest for an RNA virus. And this particular virus is an RNA virus. Now, for you science nerds, coronaviruses are a family of enveloped, positive sense, single-stranded RNA viruses. Or you'll see, if you wrote that out in shorthand, it'd be a plus sign, small s, RNA viruses. Okay, that's not super important for you to know as a nurse taking care of a patient, but some people are really into that stuff, so I wanted to make sure that I included it. When you look at the picture, our graphic, you can see that it has 5 structural proteins: spike S, envelope E, membrane M, and nucleocapsid N, and number 5, hemagglutinin esterase. Okay, so you see those on there in a shorter version. What I want you to pay attention to right now is just that S protein. Okay, so write that down in your notes. S protein, and remember that it is sticky, so write S for sticky. Now let's talk a little bit about how this family of viruses is grouped. There's 4 main subgroupings: alpha, beta, gamma, and delta. I know that sounds like Greek life, but we really just have these broken down into these 4 main groupings. Now, coronaviruses, they're not new. They've been around. They were first identified in the 1960s. And there's some common ones. I'm sure you may have even had one of these at some point in your lifetime. Now, these aren't named as fun. You'll see you've got 229E, NL63, OC43, HKU1. Okay, those are not very exciting. But look at the families that they're in. The first 2 are in those alpha families. The second 2 are in the beta families. That's what those subgroupings are. Again, just giving you a foundation so you can speak intelligently to this when you're caring for patients and when you're interacting with other people of science about coronavirus. Now, these 4 are common. Like I said, you may have had one or more of these yourself. You've definitely run into people that have had these types of coronavirus infections, whether you realized it or not. But there are 3 others in the corona family that are really nasty. Let's take a look at those. See, when coronavirus gets really nasty, these are 3 that I want you to remember: MERS-CoV, SARS-CoV, and SARS-CoV-2. Okay, now that's just an idea. We talked about the 4 that are somewhat friendly, not that big a deal, but these are the 3 that get really nasty. They're widespread and they've wreaked havoc. Let's look at their history. Now, the MERS-CoV, it's the beta coronavirus. It caused Middle East Respiratory Syndrome, or MERS. SARS-CoV is the beta coronavirus that caused severe acute respiratory syndrome. That's where it gets its name, SARS. Now, the one that we are most interested in currently in the year 2020 is SARS-CoV-2. That's the novel coronavirus that caused the coronavirus disease of 2019, or COVID-19. Now you see you've got the original over there with SARS-CoV that gave us a problem with SARS. This virus has some similarities, which is why it's called CoV-2. Now, I'm sure you've heard the talk about where these came from and who are the reservoirs. These viruses can often be reservoired in animals. So for example, the MERS-CoV one came from civet cats in 2003. So these little fellers, these were the guys that were the reservoir for the MERS-CoV outbreak in 2003. SARS-CoV had a different reservoir. This was from like dromedary camels. This was in 2012. So in 2003, it was the civet cats. In 2012 is the dromedary camels. Now what we're dealing with in 2019, they're not exactly sure. Might be the pangolins, it might be horseshoe bats. They're not sure exactly what it was, but those are some striking photos for you to take a look at. Now, the exact transmission, I want to be very clear with you, is not identified for sure. This is what they're considering. They do know the place in Wuhan, China, where this originated, but they don't know exactly how. But I want to go back to that name, SARS-CoV-2. So when you hear people reference COVID-19, that is the disease that is caused by SARS-CoV-2. So that means what? Severe acute respiratory syndrome, coronavirus number 2. That's what SARS-CoV-2 means. And COVID-19 is the corona viral disease that happened or started in 2019. All right, thanks for hanging with me. Now let's review. Coronavirus earned its name from the spiky proteins that are visible underneath a microscope. There are 4 main subgroups of coronavirus, and there are 4 coronaviruses that commonly infect people around the world and 3 that have caused significant and widespread infections. MERS-CoV, SARS-CoV, and SARS-CoV-2 that can cause COVID-19.